So snoring and sleep apnea can be caused by multiple factors. One of the primary reasons is the patient's anatomy and physiology. So if there is a restriction in the patient's nose or the back of the palate or the back of the throat, this can increase the airflow resistance when the patient sleeps at night, increasing the likelihood of snoring. And if the resistance is significant enough, it can cause obstructive episodes, which are the sleep apnea related symptoms that the patient can experience. It's a very good question. So if you have a bed partner that has witnessed gasping of air or pauses of breath at night, even just for a few seconds, that could raise the suspicion that you might have sleep apnea. Also, sleep apnea patients tend to have associated daytime sleepiness. So heavy snoring, daytime sleepiness, witness gasping or choking at night are all potential symptoms for sleep apnea. And one of the ways to diagnose or investigate whether a patient has sleep apnea or not is through something known as a sleep study, which I will be able to arrange for my patients, where they will have a medical grade monitoring of their breathing, respiration, and heart rate overnight to then provide me with a diagnosis of sleep apnea for the patient. Yes, absolutely. So there are a range of treatment options for sleep apnea. One of the forms of treatment for sleep apnea is known as continuous positive airway pressure, or that's CPAP for short. It's a pressurized mask that the patient wears over their face at night when they sleep to blow pressurized air into the nose and throat to keep the back of the throat open. And it's one of the potential options that I will walk through with my patients. However, we do know that close to 1 in 3 patients are unable to tolerate this form of treatment. We can then also discuss other forms of treatment in the form of sleep surgical interventions after an assessment of their upper airway to allow us to then customize operations to the palate, the back of the throat, and potentially the tongue as well, in order to reestablish the upper airway when they sleep at night to allow them a deeper, more restful sleep. So sleep apnea is a serious medical condition, and if untreated, can have negative consequences and health impact overall. But the main concerns would be significantly elevated risks of strokes and heart attacks that are potentially life-altering or fatal. So those are the main concerns. There are also other forms of increased risk of medical comorbidities in the form of increasing blood pressure, hypertension, increasing risk of diabetes, and also impact on cognitive function. So there's a range of serious medical conditions associated with sleep apnea if untreated. So the first advice I would generally give patients is in the form of lifestyle modification. So anything you can do to maintain and keep a healthy lifestyle with regards to constant exercise and optimal diet will be helpful. Alcohol intake is one of the key factors that can increase the likelihood of worsening of your snoring. So alcohol intake in moderation and ensuring that you drink at least 4 hours before bedtime as your last final consumption of alcohol can help with snoring symptoms, as alcohol can disrupt the quality of your sleep, relax the upper airway muscles, and worsen snoring symptoms. So general lifestyle modification can be attempted in the first instance, and if those fail, then I'll be more than happy to walk patients through the subsequent options and alternatives.